Hello, I am Danielle Ondreka with Kettering Health, exercise physiologist, and we are here today with Dr. Melissa Butler talking a little bit about senior adults and exercise and weight management. So do you want to introduce yourself a little bit and tell us about yourself?
Sure. My name is Melissa Butler. I'm an internal medicine physician, and I'm currently working at Years Ahead Health Center. I've been working there for nearly 3 years now, but I've actually been with the Kettering Network since my internship, which started 20 years ago.
Oh, wow.
So I've been with the network for a long time, and I have a passion for healthy lifestyle. So I'm happy to be here today.
That's wonderful. Well, we're very, very happy to have you. So you obviously have a passion about weight management. You know a lot on this topic. So kind of tell me a little bit about how you got interested in that subject, maybe particularly as it pertains to senior adults.
Well, Years Ahead Clinic is a clinic that's targeted towards patients in their years ahead, hence the name. So we're looking at a little bit of the older population. But in terms of just weight management and healthy living, that just stems from trying to make my patients as healthy as possible. I think, it's no secret that there's so many diseases that I directly related to our lifestyle and, quite frankly, our weight. And so targeting healthy weight is extremely important for managing so many medical conditions.
That's wonderful. I love that you kind of attack it from both sides, that lifestyle and also what we think of as traditional medicine. That's wonderful. So question for you. Why is it so difficult to lose weight as we get older? I know personally my grandmother struggles with this. She lives a fairly healthy lifestyle, does Tai Chi, eats fairly well, but even she has difficulty losing weight in her older age. So what would you suggest?
Yeah, so this is a very common and recurrent theme. I mean, both male and female. As we get older, there are several factors that come into play. And one of the first one is that our metabolism, quite frankly, does really slow. No, it's not just in people's head. It really does become a little more difficult. Part of the reason for that is that particularly after the age of 50, we all start losing muscle mass at a rate of about 1% to 2% per year. And now we can combat that through strength training, adequate protein intake, but the loss of muscle mass will naturally reduce our metabolism. So really trying to fight that so that we don't lose as much muscle mass is really important. Also, just metabolic changes that come along with menopause can lower our metabolism. And then, two, just as we get older, we tend to become less active. Kids are out of the house, maybe we retire, we become a little bit more sedentary. And then sometimes too, just unhealthy habits start to creep in. We don't want to cook as much anymore because maybe we don't have a family to feed at home and it's maybe just 1 or 2 people and it's just easy to get fast and convenient food. So there's a lot of factors that come into play, but it truly is a little more difficult just because of the metabolism slowing.
So what would you suggest to people who are struggling? What are some tools that they can use to try to combat that?
So, there's a lot of factors that go into weight loss, of course. So, if we're just trying to talk about the metabolism, as I mentioned, strength training becomes really, really important. So there's a huge focus on cardio, which is absolutely very, very important. So cardio just naturally will burn calories. And then it has a number of other good health benefits anyhow. Cardiovascular health, it actually helps prevent cognitive decline. So cardio is super important. But strength training often, falls by the wayside. And there's not that many patients or people in general that actually engage in regular strength training. But if we can factor that into our weekly routine, it can really make a huge difference in terms of boosting our metabolism.
Oh, absolutely. I tell my clients all the time that having muscle mass, all the time it's burning calories, even when you're at rest. So when you're doing cardiovascular activity, it's only during that moment that you're really burning those calories. You do reap those cardiovascular results, but muscle works for you all the time.
Absolutely. Yeah. And so, sometimes people don't really know, okay, how do I get involved in strength training? It can be as simple as calisthenics. Calisthenics do count as strength training. So that's like, modified push-ups and squats, things like that. But just at least having a couple sessions with a trainer can be very helpful in terms of developing a short circuit that can fit into your schedule and really help.
Very good. I love that. So as far as the diet goes, we talked a little bit about the strength, about the exercise. What are some dietary changes that someone could possibly think about making?
Yeah. So obviously, overall caloric intake is always important. And there's multiple studies that show that people always underestimate how much they eat and overestimate how much they exercise. And we're probably all guilty of that. So sometimes actually just being very mindful of what we're eating so that we can really identify what we're doing wrong is important. So that is the food diary. And I'm sure we've all heard that term, and nobody actually ever really wants to do it. But if you could just do it for a week, it can make a huge difference, because then you really know what you're putting in your mouth day in and day out. So that's where I would start. And that way you can identify, okay, how often am I eating out? How often am I choosing prepackaged processed foods, which are full of calories that are almost always junk calories?
Yes.
And so that, I think, is a really great place to start. And then just really basic general tips are reduction of refined carbohydrates. So that's desserts, cookies, cakes, sugary things, candies, of course, all the stuff we love. But also things like white breads, pastas, white rice, white potatoes, reduction. So I didn't say elimination, but reduction of our carbs and increasing our vegetables, fresh vegetables in particular, and our protein. And for those people who are vegan or vegetarian, I mean, there are still many healthy protein options where you can still entertain a vegetarian or vegan lifestyle, but still increase your protein intake while reducing your carbohydrate intake.
Absolutely. Yeah. And we've mentioned protein a few times now.
Right.
Do you have any suggestions on good protein sources, whether you are vegan or vegetarian or you do eat meat?
Right. You know, most of us just want something that's relatively easy. And I totally get that. I mean, I'm a busy full-time physician. I have a mom of 3. So easy is really important to me. So I think eggs are a great source. Hard-boiled eggs, scrambled eggs, whatever those are very easy and fast, especially if you boil some eggs on the weekend and have them in your refrigerator. Canned tuna, canned salmon. Those are nice, easy, quick protein sources. Cottage cheese, string cheese. Those are also good protein sources. And then getting some of the pre-prepared lean, like the rotisserie chickens, things like that can also be helpful. I tend to shy away from lunch meats and processed meats like that because they're just not as healthy for us.
A lot of salt content.
Yeah, a lot of salt, and they're just more processed. And there are some studies that suggest that there could be an increased risk of malignancy or cancer, but really, there's no one thing that does that. And then for people who are vegetarian or vegan, beans are a great source. Any legumes are a great source of protein. Tofu is a great source of protein that's lower in carb. Some of the yogurts, like the almond yogurts or the soy yogurts, even edamame is really yummy, nice, healthy, easy snack. So there are easy and quick ways that we can incorporate healthy sources of protein.
Absolutely. Almost all of those things are very, very quick or almost already ready for you to eat.
Right.
Which is wonderful. So you really don't have to put a lot of work into making a meal possible.
Right.
And I always suggest to folks as well to have your protein source pre-prepared. If that's an area where you see that you're really struggling, at least have the protein done. It's sometimes a lot quicker to prepare the vegetables, to prepare, some of that whole grain rice, especially if it's something you can like steam or throw in the microwave. That stuff's more quick, but sometimes it's that protein that we're really hurting to get prepared.
I agree. And you had mentioned pre-preparing, and I'm a huge fan of that. Just after a grocery trip, just taking and just put it into your schedule. Know that you're going to take about an hour after a shopping trip and just have some things that are quick. It's not quick to prepare them, but ready to go in the refrigerator.
Yes.
So, after my shopping trips, I usually, I'll have a huge melon. I have all my fruit. I have some vegetables. And if I have it all cut up, washed, and ready to go in glass containers in my refrigerator, my kids will eat it. If it's not cut up and ready to go, they will not. And the same thing goes for my husband who could cut it up. But so it goes for all of us. If we pre-prepare it and it's in there, we're far more likely to eat it. When we're hungry, when we're hungry, we want something quick and easy. So if you just have it ready to go, it makes a huge difference in trying to make healthy choices.
Absolutely. I think there are things we all know that we should do and that we can do.
Right.
But we tend to take the easy road.
We do. And I mean, that's okay. We just have to acknowledge where our weaknesses are and try to combat that.
Exactly.
Yeah.
I think that's huge. Yeah. Acknowledge where your stumbling blocks are and then figure out what you can do to combat those, because we have to have a plan.
Yes.
If you don't have a plan, you're just not going to do it.
Right.
I'm a person who uses my calendar. I'm a person who likes to use lists. And for me, if I go into a grocery store and I don't have a list, it's game over. I am am going to buy that prepackaged something that looks delicious because maybe I just want to try it or it's on sale and it looks good. But if I have a list and it's not on my list, I'm much more likely to leave that thing on the shelf.
Right. Exactly. Yeah. So I do think planning is really important, and trying to make things as easy for ourselves as possible is important. Consistency is the other thing that I find that falls in the way of, hampering our weight loss efforts. We might try something for a week or two, and then maybe we're not seeing quite the results we want, and then we just stop. So, weight loss and weight maintenance is really just a lifelong journey. And there's no easy or quick fix. There just isn't. It's just a matter of day after day trying to make the right choices. I always tell my patients that if we can be really good 85% of the time, that 15% of the time is not going to sabotage our efforts. And so, those are our birthdays, our holidays like Thanksgiving and Christmas when we go on vacation. So, but if day in and day out, we're making those good choices, we really can be successful.
Yeah, it averages out.
Yeah, it does.
It 100% does. Yes.
Yeah. Some of the other things that I think, just kind of that I notice that where people can fall into trouble is late night snacking is another big one, and sleep in general.
Yes.
So lots of studies show that people who get adequate sleep actually weigh less on average than people who are sleep deprived. So focusing on sleep is super important. So if we're staying up late watching movies and snacking, of course, that's gonna sabotage our efforts.
Also, when we're tired during the day, you're much more likely to pick up something that's not as good for you because you're tired, you're a little cranky, you just want that little snack, it'll make you feel better.
Yes, 100%. And the sleep deprivation, it's not just because we have more time to eat or that's when we're eating. Actually, sleep deprivation is a stress on our body, and we do release higher levels of cortisol. And so that can contribute to weight gain as well. So just sleep is super important. Try to eliminate late night snacking. I'm sure some people have heard about intermittent fasting. It's kind of a new big deal. But, there's a lot of validity to intermittent fasting too, and it really, really works well for a lot of people. It's essentially just time-restricted eating. So you're choosing 8 hours in the day. This is when my eating window. The other 16 hours, you're not eating. You can drink black coffee or, unsweetened tea or water, but you're not really consuming calories during that time. So that can be a very effective method for weight loss as well. Can have some other health benefits too in terms of longevity, believe it or not, and metabolic improvement.
That's wonderful. And that's something that someone could absolutely come and see their doctor to talk about, right?
100%. Yeah. Some people worry if they have diabetes, can they really do intermittent fasting? And absolutely you can, but you may want to discuss it with your doctor, particularly if you're on insulin or other oral medications that lower your blood sugars.
Love that. Good. Phenomenal. So are there any other thoughts that you have kind of closing out our talk today on strength training, cardiovascular training, eating, any other sort of things that we should discuss when we think about weight loss?
Well, really, my number one message is that absolutely anybody can lose weight at any age. Everybody can start exercising at any age. It is literally never too late to reap the benefits of regular exercise. And although I did focus a little bit more on strength training, that's just to really boost the metabolism. Cardio is also very, very important. And so I think making sure we just incorporate it into our weekly routine. And I do understand that people have busy lives, but it is a matter of just making it a priority. Like, we do have to prioritize our health because really, if we're not healthy, we can't do almost anything else that we devote our time to. Right. So it's just making it a priority.
Yeah. Find your why, find what keeps you going. When you stumble, get back up,
right,
and just keep going.
Yep.
That's wonderful. Well, thank you so much for coming to speak to us today. I know that I really appreciated some of those tips that you shared, and I hope that everyone else did too.
Well, thanks for having me.
Absolutely, yeah. Well, thanks again for joining us. Again, I am Dani Ondreka with Kettering Health. We were joined by Dr. Melissa Butler, and we hope that you have gained some insight today on your weight loss journey or gained some tips that you can share with someone else. Have a wonderful day, and we'll see you next time.